Tisha, and I am a psychiatric nurse practitioner. I'm currently working in Pennsylvania at the state correctional institution called Muncie for Women. When I first heard about the National Health Service core program, I personally got excited because I had a large amount of debt from student loans, and I thought, okay, I can kind of kill two birds with one stone. It could help me pay off my debt, and at the same time, I could serve the community. I chose to work in an underserved community, being mental health, because where I live in Pennsylvania, we don't have a lot of psychiatrists. I was working as a staff nurse, and I would have a lot of patients who would end up in the hospital because they really didn't have a psychiatrist to follow their care. And so I decided to go back to school to focus, for that reason, on being a mental health provider who could prescribe medications and do counseling. I get motivated to go to work every day just knowing that I'm going to be able to hopefully help somebody who, before they ended up in prison, more than likely didn't have any mental health services at all. And a lot of the women who are leaving now say to me, now I know that this help is available, I'm going to stay on my medication. I'm going to continue to get counseling so I don't end up in prison again, and so I can serve society in a better way. I would tell other possible candidates for National Health Service Corps that it's very rewarding. Rewarding and also fulfilling, because at the end of every day I feel as though I've made a change. It may be a little change, but I feel as though I made a change in someone's life.